Hello everyone, hi, I'm Jewel and welcome. Welcome to my channel. Before we get started, I just want to say I hope everyone is doing great, that your health is steady, that your families are doing well, and that you have everything you need in this time of COVID spikes all over our country. Today I want to talk about patients like us, of course, staying in place. We've been in place now for, over, I guess, almost 8 months now, for those of us in the CKD community and other communities that have immune issues. And of course, our home has become our sanctuary. We shop online, at least I do, and groceries and other things that I need. And for many of us, this is how we've been living our lives. But for some of us, that have to go to the hospital, of course, it's very, very terrifying. I've told you about my story when I had to go to the hospital during the summer. It was, I was very anxiety driven for a while, until I got in the hospital, of course, and everybody was following protocols. So it gave me a lot of, it released my anxiety when I was in there. And for many of us that haven't had this experience, you might have this experience soon, hopefully you won't. But for those of us that have had this experience, there are two patients that want to share their experiences in the hospital, going into the hospital during COVID-19. So guys, let's get started. This information is coming from the National Kidney Foundation. So the topic is patients share their hospital experiences during COVID-19. This may be probably a two-part video, so it won't go too long, guys. So here we go. This story is written by Jim Myers, kidney transplant recipient and NKF Kidney Advocate Committee member, and Mary Bachler, transplant recipient and Kidney Advocacy Committee regional captain. Recently, we both had to visit our local medical facilities. For most people, this might be concerning. However, for kidney transplant recipients like us, it was terrifying. We wanted to share our experiences with our fellow kidney patients to help them understand what to do to expect if they find themselves in similar situations. Jim's hospitalization. I have polycystic kidney disease, which is PKD, and I'm a transplant recipient who recently celebrated my 4th year anniversary. I was recently hospitalized after an NM gastrointestinal bleeding scan. An endoscopy and a colonoscopy revealed that I had gastrointestinal hemorrhage. Apparently, the majority of the bleeding was caused by diverticula that burst. I was nervous about the experience. I had barely left my apartment since the pandemic to reduce the risk of contracting COVID-19. I was put on the non-COVID-19 wing of the hospital. I had a nurse and an aide on every shift. I had a gastroenterologist, a nephrologist, and a hospitalist that visit me at least once a day. I had a port for blood draws and infusions, and a nurse on the IV team checked my connection to my port and infusion bag at least twice a day. The nurses and the aides dropped by my room at least once every hour. A social worker stopped by twice during my stay. I appreciated the attention and the care they provided. What I appreciate even more were the various ways that the practitioners tried to protect me from contracting COVID-19 while I was there. I came into the hospital by ambulance because I was extremely lightheaded due to blood loss. Although social distancing was not possible under these conditions, PPE was always worn and I was masked. I noticed every time I had contact or a conversation with anyone from the hospital, they stood a minimum of 6 feet away from me. Physicians and staff always wore PPE in my room, including masks, gloves, gowns, shoe coverings, etc. I wore face masks anytime someone came by and never shook hands. I have been fighting kidney disease for over 40 years and average about 2 hospital stays a year. I've never seen this much deliberate care. Near the end of my stay, I walked around the floor with a caregiver and a nurse to help me prepare to go home. I was asked to wear PPE, and the nurse and people in the hallway always maintained social distance. On discharge, both the nurse and I were full with PPE. Okay, guys, this was Jim's hospitalization story when he had to go to the hospital for polycystic kidney disease, and he was telling all of us how kind and how prepared the nurses and the staff were when they were dealing with him because they had on all their equipment, and of course he had on his mask when they were tending to him, and he had a variety of people visiting him to make sure that he was safe and that everything was going well. And of course, he came out of this experience, with appreciation for the hospital and everything that they were doing for him. So, guys, if you like this video, please like, share, and subscribe. And I'm sending all of you so much love, so much affection to let you know that you are not alone in this journey. As you see by Jim's experience going into hospital, there were so many people that were there for him, that protected him from COVID-19, that watched over him, and it made him very, very appreciative of all the people in the hospital that took care of him through his crisis. So, guys, this is the story that Jim is telling, that if we do have to go into the hospital, if you're a transplant recipient or a dialysis or doing dialysis, the first thing you need to do, of course, is always call on your team, your transplant team, your dialysis team, to let them know what's going on, and they will be there to help you get through this experience. So, guys, I hope you like this video, and I will talk to you guys on the other side. Bye.